Well, hello, everybody, and welcome to another Hero webinar. I'm Paul Terry. I'll be your host. And on the screen, you see a couple of people who are really going to make this a meaningful hour for you this spring. It's spring and it's Mental Health Month. The topic that they're going to discuss with us today is it time for a purpose-driven fresh start? Spring couldn't be a better time for us to think about that question. And I'm going to introduce Vic Strecher and Kate Sommerfeld in a moment. But let me take the liberty of associating this important topic today with a reminder for all of you that are on today that Hero Forum registration is now officially open. The theme is beautifully aligned with what we're going to be talking about today. You can see our title for 2021, October 11th through 15th. We're going to see you in Austin, Texas. And we're going to talk about bouncing back, boosting mental resilience, and building organizational immunity. And again, consistent with our discussion today, what we're really going to focus on is how should the health promotion profession be refreshing itself, be reimagining how we do our work post a pandemic, post such a god-awful racial charged year. We're going to tackle both those topics. And again, some of the answers to those questions you're going to hear our guests talk about today. Those of you who are Hero members, also remember our summer think tank is right around the corner, June 7th. We're doing a virtual Hero think tank. Austin is live, hybrid if you can't get to Austin, but we want you there. By that time, we're all going to be immune as can be. But June 7th is going to be virtual. We're going to do our summer think tank. The topic couldn't be more timely. It's called the War on Truth, the employer's role in plugging the disinformation rabbit hole. And boy, do we have a robust agenda with really top experts from around the country joining us to talk together about what employers can do to in these challenging times. Let me introduce our guests today because both have such important track records and have such success stories to tell. Let me have you meet Kate Sommerfeld. Kate is the president of Social Determinants of Health Institute and the vice president of Community Relations and Social Investment at ProMedica. This is her LinkedIn page. You can learn that she's been in social justice work and social change work, child advocacy. She's a bachelor's at Purdue University, and she's gotten her master's in public administration at Bowling Green University. I am proud and pleased to report that the Modern Healthcare magazine just last year named Kate, ProMedica's president of Social Determinants of Health, one of the top 25 emerging leaders in this country. And I think you'll see why when you see her interact with you all and with Vic Strecher today. Look to ProMedica's website, you'll find Kate Sommerfeld's executive profile. You can see that she's been overseeing the development of 10 years of a $50 million community revitalization initiative. She'll be talking about some of the outcomes of that work and her work with Vic today. Vic literally needs no introduction. Vic Strecher has been such an important friend and leader in the health promotion field and for Hero and with Hero over many years. He's a big enough deal. He's got his own website, for goodness sakes. So do jump over to just put in vicstrecher.com and you'll find his website. This one reminds you that he's founded Kumano, formerly called Jewel, a major paradigm shift in how individuals engage in the pursuit of well-being while offering organizational support. You can find his books there, his book Life on Purpose, one of his narrative novels On Purpose by Vic Strecher. You can find Vic everywhere. I'm only briefly going to embarrass you, Vic, with some of the places that I think people just must go to see you talk. If you want a really cool primer, only 25 minutes, he's got a TEDx talk. He'll touch on some of these concepts today, but this is really one that I think is worth watching. Or if you've got like a day or two to learn about purpose and death, he did this Coursera course that last you and I talked, Vic, hundreds of thousands of people from around the world have learned from Vic online. But if you don't have the 3 days or 4 days or whatever it takes to get through all of Vic's course, Vic, I found this 1 hour Q&A thing really quite well done. So you can find that on YouTube. Just put in Vic Strecher and Purpose and that'll pop as well. If you go into PubMed, which I have a lot to do whenever we're talking about big deal researchers here, you can be reminded that Vic has been writing now for years about the power of purpose and the science behind purpose. But what I find so interesting about Vic's career is if you kind of go page 6 out of the 10 pages of publications here, you'll see that he had a whole nother very rich, robust life in terms of leadership in tailored communications in his professorship at the University of Michigan. I didn't forewarn you, Vic, but if time allows, given vaccine hesitancy is such a big issue for the country right now, I can't help but kind of seeing if we have time to get your reflections on tailored messaging around vaccines. So let's see how the day goes. If I were to name the one distinction of many, though, that Vic Strecher has that I'm proud of, Vic, just last year was awarded the Mark Dundon Researcher of the Year Award by Hero. So if nothing else happens to make Vic's life full of purpose, I'd say being honored by his colleagues from around the country as one of the best researchers in all the land, in all the world. You can't get much better than that. So with that, I'm going to stop bragging on you two, and I let go of the screen, Vic, and I'll have you take it over. And thank you both so much. We just can't wait to interact with you all. Kate and Vic both assure me, get on with your questions early and often. We're just going to take them as they come. So don't hesitate to jump into the Q&A box, and we'll be watching for your questions. So I'll turn it over to you, Vic.
So Paul, happy Cinco de Mayo. And thank you so much. What a wonderful introduction. Way too much, which is what you always do for me. And I greatly appreciate it, actually. So thanks so much. And thanks for inviting both Kate and I on. Kate is, as Paul said, just an amazing leader in this area of social determinants and health. And so really looking forward to doing this, Kate. We're going to have some slides that we're going to show. We're going to show a model that incorporates both these personal determinants of health as well as these social determinants of health. And even philosophically, there's something really important about this, because so far up to this time, the wellness and then even the well-being movement has largely been focused on what's between your ears, your own mindset, your own cognitions, your health beliefs and things, and then your own personal behavior, but not a lot about the structure of our society and how the structure of our society really influences our health and well-being so much. And we'll show you just how much, because we've been working with ProMedica with the Harris poll. And you're familiar with the Gallup poll. Well, the Harris poll is a huge polling group that has a rich history that dates back to John F. Kennedy, actually, where they were the pollster for JFK. And we've been working really closely with them. And we're now actually launching our 4th poll coming up. But we have a national poll that we fielded in December of 2020. So we're going to show some amazing results there, and a model that we built as a result of that. And then we'll show a bit about the products that we have developed jointly around trying to address these things. So we're not just going to talk about it as a problem, we're going to talk about solutions to the problem, and then we're going to get into some specific cases. But at the same time, we're really open to questions, and Paul's going to look for questions, Kate's going to look for questions, I'll look for questions when Kate's talking, and we'll be free to bring those up. We're also going to have a poll with 2 questions. So just to let everybody know, it's going to be a full fun-packed hour, we hope. And Kate, I'm just so happy that you're on here.
Yeah, thanks so much, Vic. Huge thanks to Paul and Hero. Really excited. In this new webinar environment, lots of us are on Zooms, and so really do want to make this as interactive as possible. So go ahead, put your questions in the chat, and we'll take those as we go. And again, thank you to both Paul, to Vic, and to Hero as well.
So let's just start with a little background on some of the issues that we're dealing with right now. 1 in 3 employees, and this is coming from our new Harris ProMedica Kumanu polling that we've been doing with over 2,000 people. And in both October and December, what we found was 1 in 3 employees are struggling with essential needs. And these essential needs include food insecurities. And we asked this question, like, have you in the last 12 months run out of money and not had enough money to pay for food? This is a very direct question. And these are people who say, yes, I have actually run out of money. And these are full-time employees we're looking at. Part-time employees have even bigger issues. Housing insecurities, financial insecurities. 1 in 3 full-time employees are struggling with these essential needs. 2 in 5 employees are saying, I do not have a strong purpose in my life, or I do not have a strong purpose in work. Even more employees are saying that. So we're finding both this mindset of, am I getting my purpose in my life fulfilled by my work? Do I have a strong direction and purpose in my life? We're finding that a significant number of people, 40% plus, between 40 and 50% are saying, no, we don't have that. 2 in 3 employees, this is very scary here. And we found this in our poll. This has also been reflected in other national polls as well now. 2 in 3 employees are suffering from anxiety disorder or depression, significant depression symptoms. And we've used the GAD-7, if you're familiar with anxiety scales. We use the PHQ-9 for the depression scale. 2 in 3. We have found, by the way, that has tripled over the rate of COVID during the period of COVID. So during the pandemic, in the beginning, we found only 1/3 as many people saying that they were suffering from anxiety and depression. That has tripled now. So we are in serious issue. We have serious issues. And also, employees typically say they are less depressed than non-employees are. We find the reverse now. Employees are actually more likely to say they are suffering from anxiety and depression. 1 in 4 employees plan to leave after the pandemic. And in fact, there's another survey that found 1 in 2 employees are thinking about leaving their job after the pandemic. In other words, people are unsettled by this. They're finding new directions in their life. They're going, this isn't doing it for me. The way I'm working right now, it's not doing it for me. And super important, 2 in 3 business leaders are now reporting, this is a really recent survey, February of this year, Willis Towers Watson found 2 in 3 business leaders are reporting that their well-being programs are falling significantly short of supporting their employees' needs, especially their mental and emotional health needs. So that's what we want to talk about in this May, this mental health month, this Cinco de Mayo, this fresh start that we all have. Maybe we can just stop for a second, take a breath, and we can try to transcend what we're currently doing. We can transcend how we think about this. And rather than having everything reflect on what we already believe, maybe we can try to believe some new things. Maybe we can open our minds and start thinking about new ways of doing what we've all been doing for a very long time. And we have tried to do that at Kumanu, at ProMedica, myself personally. I know that Paul and others have been thinking much, much more at Hero as well about root causes. What's really happening deeply? What are the root causes of why we get sick, mentally and physically? What are those significant root causes? And we see them broken into 2 basic paths. One are personal determinants of health, and the other are social. So looking at personal determinants of health, we've gone back to a very core factor. Do I have a direction and purpose in my life? Also, am I able to regulate my emotions? That turns out to be a really important factor, which we'll get to later, in whether we become resilient. And our resilience level, that's our ability to bounce back, right? So those sorts of things are very deep root causes, deep core factors in whether we change our personal health behaviors, if we have better diets, or if we quit smoking, or we work out more, things like that. But it certainly strongly relates to emotional and mental health issues. And just to look at that, just to take purpose in life, which is one of our very central themes in what we do at Kumanu, we have looked at through this purpose poll, through this poll with Harris, looking at people with low purpose, and this is the lower 75th percentile, and high purpose. These are people in the top 25th percentile. And we see huge differences in resilience between those with high purpose and low purpose, emotional self-regulation at work. Can I change my emotion if I'm feeling threatened, if I'm scared, if I'm stressed, if I'm worried, if I'm angry? You see people with a strong purpose are much better able to regulate their emotions, less likely to be depressed than anxious, more committed to their work mission, much more engaged at work. And this is the Utrecht work engagement scale we used. You see it's really significantly higher, over 4 times as high. They're more likely to want to plan to stay at work. And actually, getting to Paul's question, they're far more willing to get vaccinated for COVID. And so that's interesting. So you see all of these are really, really bigger if you have strong purpose. So, and we know we can change purpose. We can actually improve that. Now, social determinants are more structural. They are really significant, it turns out, in this, and we've been ignoring these as a field, I would say. By and large, not everybody has, but by and large, we've been ignoring whether you have food insecurities or housing insecurities or financial insecurities or childcare insecurities. And I'd like to let Kate discuss these kinds of insecurities and what they do in the workplace.
Yeah, thanks, Vic. I think from the stats perspective, both as an employer and also as a healthcare professional, you take one of those, either employees who are planning to leave, those that are suffering from depression, 1 in 3 struggling with those basic needs. Individually, one of those stats would be concerning, but you bundle those all together, and really is that clarion call as employers that we have to start to think differently. And so social determinants are essential needs, basic needs, depending on the industry and jargon you want to use, really are those things like housing, food insecurity, food, some of the very basic things that historically neither healthcare nor employers have really thought much about. You know, if you're much like our company, we may get the one-off employee who has had a critical life incident or an emergency, and we may be able to hear, you know, I'm struggling with food or I'm struggling with housing. But by and large, it's not something as employers we historically have thought a lot about. But that's really starting to shift. We're seeing more and more employers start to, one, understand that they have needs in their workforce, and 2, wanting a workforce and a company that really is supporting the overall basic needs of employers. And so a few examples of these, again, things like housing, food, financial strain, those very basic or essential needs. It may be an employee who is struggling to afford medication. It could be around behavioral health issues, you know, childcare in the COVID environment. I know many of the employers are starting to struggle with either childcare or elder care. So even employees having to take care of either young children, or as we're seeing more and more of our workforce starting to be caregivers for their parents or guardians, again, childcare and elder care. Yeah. Food access, transportation, housing, that list goes on and on. Yeah. But they're really the very basic needs that now employers are starting to think about how we solve for. Yeah. And so one of the questions starts to become, well, why, right? How are we seeing this show up in the workplace? And so for a lot of employers we're starting to dialogue with, you see things like turnover, total cost of care, an ability for an employee to show up. Think about something like transportation. If you don't have a way to get to and from work, that obviously really impacts your ability to show up on time. And so in the workplace, it's showing up in very real ways. And I would say anecdotally, that COVID is certainly just exacerbating a lot of that. And so as an employer, thinking through how we can play a stronger role in some of this issues.
And Kate, you know what? We already have some questions about this. It's so cool. One is, does our survey with the Harris poll break down responses by industry? And we do. So we certainly find some industries are doing better than others. And we don't really have time to get into that in detail right now. But one industry that has been suffering, as you might guess, is the healthcare industry, both in terms of purpose, as well as in these personal determinants, as well as social determinants. And Kate, you're at ProMedica, which is a healthcare organization. We'll get into some examples there. Another question, which is great, per Maslow's hierarchy, if 1 in 3 are not meeting their essential needs, how can we expect them to focus on their higher levels of well-being? Absolutely. Spot on. Thank you. And there's a neat comment about single moms. There are clearly more single mothers than single fathers, but I believe you could use single parents with no loss of impact. Yep.
Well
Totally.
said, Ray, I think on that.
Yeah. Well said. So now, if one of the things that we have found, just looking at these mental and emotional health issues, looking at depression and anxiety, and whether a person is burned out, and we use a standard burnout index, and whether you have sleep disturbances, you see people with higher SDOH insecurities, you see how incredibly predictive they are. You see that it's nearly twice. If you have high SDOH insecurities, food, housing, finance, you're almost twice as likely to be suffering from depression, anxiety, much higher level of burnout, much higher rate of sleep disturbances. So these are huge predictors. We're used to the health belief model and other kind of models that are cognitive and belief oriented. And now here we're seeing these enormous structural barriers. So one of the things we wanted to ask you guys, this audience, and by the way, we have 92 participants. That is so awesome, Kate. If everyone wouldn't mind taking the time to answer 2 questions for us, we'd love to put these answers, if we can, up on the screen too. The first one is, how much do you agree or disagree with the idea that employers should play a proactive role in supporting employees in resolving and reducing social determinants issues? And you might say, this is not the job of an employer. And that's something we've been really interested in. So if you wouldn't mind just indicating whether you strongly disagree with that, basically saying that they should not play a proactive role, all the way to strongly agree, where you say, I totally agree that employers should be playing a proactive role in supporting employees and resolving these kinds of social determinant issues, these structural issues.
I think Ariane will have some of our results findings as well. So I think those will pop up, and wow, we see pretty big significant around agree, about 51%, about 20% somewhat agree, and 28% strongly agree. So pretty big trends. One individual somewhat disagree. So that'll be interesting to dive into.
Yeah, sure. Okay, now if we can go to the next question. I have another one. How satisfied or dissatisfied are you with the services your organization has provided to employees to address social determinants issues? And I would ask that in particular, the listeners who are in organizations that are using that have wellness or well-being kinds of services. How satisfied or dissatisfied are you with the services that your organization is providing to employees to address social determinants issues? Are you completely dissatisfied all the way, or are you completely satisfied?
Vic, one of the interesting things as we've been on this partnership journey over the last 12 to 18 months is the different perspective within even our organization, whether you're in HR or you're a hiring manager, and how well is the organization really supporting our employees. And so it's been a really interesting dialogue amongst the different departments, even with our very large $7 billion health system.
You got it. Here we are. Okay, now we're seeing quite a bit of dissatisfaction, actually. We're seeing some somewhat, and we're seeing some satisfied. 2 people said completely satisfied, but quite a few people are saying I'm dissatisfied or somewhat dissatisfied, or I'm kind of in that math level, right in the middle. Any thoughts about that, Kate?
Well, we have a comment on here. People are so overwhelmed. They're having having a central way to access resources for many is really invaluable. And so someone just commenting a lot of different things coming to employees, and how do you make sure that there's that central focus. And then one follow-up question, what I have been asking, if employers should be addressing SDOH, but whether which determinants and to what degree.
Yes. And I wish we had time to ask those and break it out by food insecurity or housing or financial. So obviously that's kind of a general question, William, and the way you're asking it is more relevant. That's actually how we are asking it in our Harris poll. And we're finding really, really similar findings to what you all are finding on a national level with business leaders. So very important. So We promised you a model, and we'd like to show you a model if that's okay. And this is a model based on the Harris poll, looking at both personal determinants and social determinants. And the first model I'm going to show you is called the structural equation model, and it is an eye chart. And I know that. So Kate's smiling because she knows I love structural equation models, because it's kind of melding both statistics and data with concepts and theory and modeling. So it's really important for us at Kumano and at ProMedica, as we're designing these programs, to have some understanding of what's happening. So I'm going to simplify this immediately. Just, you can see this, by the way. Happy to share this with you if you want as well. But
I think this is your Hero of the Award, Researcher of the Year award.
Yeah, right. And maybe Bad Presenter of the Year award. So I want to move it into something that's a lot simpler. And, as a professor, we love box and arrow diagrams. And I'm just going to go through this. I'm going to literally walk through different components that I think are super important for us to address in this new model that's combining social and personal determinants of health. And in terms of personal determinants, this triad is incredibly important, we have found, and not just in our own modeling of data, but in other people's now too. It turns out that people with a stronger purpose are better able to regulate their emotions, the chatter that goes on in their head, the negative thinking that's in their head. We're in fact working with a guy, Ethan Cross, who just wrote a book I'd highly recommend called Chatter. He runs the emotions lab at the University of Michigan. And what's really clear is that emotional self-regulation leads to greater resilience. Resilience has been a theme, obviously. It'll be a big theme in Austin. By the way, I can't wait to go to Austin. I can't wait to see people. I can't wait to dance with people on 6th Avenue, which I'm going to do. I'm already inviting all of you to a big party on 6th Avenue. We will be dancing to amazing music in Austin. So, and the theme, resilience, it'll be all about that, and gratitude. But people with a strong purpose have greater emotional regulation, which leads to greater resilience. And we also know that that added ability to shift your own emotion, to change your weather from stormy to sunny rapidly, quickly, which comes in part from this bigger approach, this purpose that I have. It's almost like training a person on a bicycle to ride. If you've ever taught your children how to ride a bicycle, you don't say, look down all the time. That would be looking at every event that happens all the time, every single hour. You have them look up. You have them look into the horizon. And that's what a purpose and direction does. It helps you look up into the horizon more, so you're not as perturbed by all of the crazy things that we go through, and especially this year we have. People with a stronger purpose in life have greater commitment to their organizational mission, and all of those things relate to very strong business-related outcomes. The Utrecht work engagement scale of work engagement retention, your intention to stay in your job, that's important. In another area, this triad leads directly to stronger impact on reducing emotional and mental health problems, which is really important as well. Now, counteracting this, it turns out in our structural equation model, we found that these SDOH insecurities, such as food, housing, financial, childcare, other issues, these SDOH insecurities reduce resilience. They weather on you. It's almost, there's a weathering hypothesis where it's like you have this roof, and over time, those storms that hit gradually weather. Well, SDOH insecurities weather your resilience. They start reducing and breaking that down. That's why you need some sort of strong ways of increasing resilience. And also, SDOH insecurities have this very direct, and as I showed before, super powerful impact on emotional and mental health problems. So adding all of this together into a model overall, what we have done is build two major products around this. So one is purposeful, and this is not a sales pitch. I just want to really emphasize that. We're just trying to show you our approach to intervening in this area based on this model. So that's what we're trying to emphasize here. So purposeful is something that we had built already to help people with these personal determinants of health, especially focusing on purpose, on emotional self-regulation, on resilience. And then we have this new program, that product that we've built along with Kate Sommerfeld's group at ProMedica called Resourceful. And we'll briefly mention both of these and some of the things we're finding. So with Purposeful, what we're doing is looking at an overall purpose activation platform of virtual coaching, along with a whole handful of other tools. So this isn't just an app. This is actually, although we have a very strong coaching app, a virtual coaching app that's part of your smartphone and your web and on the web, but also we have a purpose cast. For example, I'm actually interviewing Ethan Cross on a purpose cast coming up this May. In this month, because it is Mental Health Month. We wanted to talk about mental health with this world expert and his New York Times bestselling book. So we'll be talking about that in a purpose cast available to all the people who are using Purposeful. We have a whole host of other things, but very importantly now, we've been building in methods of understanding whether you're angry, whether you're burned out, whether you're connected, whether you're grateful, all sorts of other emotions. And we can look at those at the organizational level. We can also look at those now at an individual level and provide tailored, deeply tailored virtual coaching to help you manage your emotions better to become more resilient. So that's what Purposeful does. It's really addressing those personal determinants of health. Now, Resourceful.
One question on
go ahead, Kate.
External factors that challenge your purpose in life. And so any thoughts around kind of external factors and how that impacts your individual?
Yeah, great question. Very often, if we know that people who are running into financial difficulties, for example, during COVID, we ask people, have your financial issues, have they gotten worse? And people with worsening financial status indeed do have lower purpose. If you lose your job, if you have some sort of sudden problem in your life, often your purpose drops. But very often, if you can repurpose your life, it becomes stronger, building what's called post-traumatic growth. And post-traumatic growth is an incredibly related topic. It's related to purpose in life. It's also really strongly related to improved emotional mental health. Now, Resourceful is really unique now in that, we all are aware of health risk assessments. This is really a social risk assessment. It's looking at these, it's asking about these social determinants. And then Resourceful is connecting you to relevant local support all the way through national support. So it connects you with those support services with the intention of trying to activate you and engage you. And linked with Purposeful, it's looking at both of these issues. It also then over time continues to measure these things, just like Purposeful does, to start looking at insights that you might have on what's really, are we moving the needle on these things? And especially, are we moving the needle on things like emotional and mental health? So both Resourceful and Purposeful now are live, and we're super excited about them. And we've been piloting them at ProMedica, which is a very large healthcare organization. And we thought we might talk about that using a real world example. So Kate, would you like to talk about that just a bit?
Yeah, thanks, Vic. So just around Purposeful, we are in the healthcare business, and this has been an incredibly tough year on our frontline caregivers, on our clinical staff, both with COVID, with the racial injustice, and also from an economic perspective, right? It's just been a really tough year. And so mid last year, we actually launched really a focus as an organization and thinking about how we could support our own employees, connecting to their own individual purpose and mission, but also how that connects to the organizational mission as well. And so we did a series of different supports, again, trying to connect in a very tough pandemic time when we have frontline caregivers who were directly impacting and feeling, had coworkers that passed away, had family members that passed away. We're doing a lot of caregiving. And so we launched this really initiative to think about how we can support our own employees, again, connected to their own mission. What is your purpose in life? Why do you wake up every day? How do you connect back to that? And then how does that overall an individual purpose and mission connect to the organizational mission? And, it was incredibly powerful. We had individuals, both everyone from our frontline caregivers, again, who were in our hospitals in a COVID environment, really being able to connect and use this reflection to think about their own mission in life. In a global pandemic, why are they showing up every day in a very risky situation? And also help to reinforce how the organization was supporting and connected to their own mission. So everyone from our individual caregivers on the front line to our executive team. And it was a really powerful experiment and exercise. We're on a journey. It's ongoing. It's not a one and done, but it really is a journey in how we support our own organization.
Yeah.
So incredibly powerful, both from an individual perspective, both with purpose and connecting to the mission, but also around resourceful. So we've actually launched a couple of pilots, and we have about 6,000 individuals that have undergone this support and really starting a series of dialogues and workshops. So we're on a long journey. Again, it's really a transformation that's happening both at the individual level, but also the organization as well.
Yeah, and we started with ProMedica using Purposeful, and we do already have some really important data on that. So we can take a look, for example, at what percent of ProMedica employees, for example, are engaged in their work. And we find quite a large number, 67%, who has purpose in life, 68%. We can map that back to our nationally representative Harris polling to, for example, find that in the healthcare space, I know somebody had asked that question now about different domains of employment. In the healthcare space, ProMedica, which is a healthcare company, is doing much better than the average healthcare employee in terms of being engaged at work and having a strong purpose. And they are even better than general US employees. So we can start mapping that. We can take a look at the people who actually have a problem, people who have really low purpose in their lives, who are not engaged at work. We can look at this 38% at ProMedica who report not being engaged in their work. And we can take a look at improvement over time as a result of using the Purposeful product. These are all people using Purposeful. And by the way, one really important finding in wellness programs, very often the healthiest people are the ones using the wellness programs. Here, what we have found is that in both Purposeful and Resourceful, the people who need these products the most, the people who are more likely to be depressed, low purpose in life, less engaged at work, have more insecurities, social, food, housing, financial insecurities, are using these products. And that's what's really important, getting the people who need the products the most using those products. And what we found here is that those people who are less engaged are more likely to use it. And we're also seeing really significant improvements over time. That's measured by this metric called Cohen's D. A Cohen's D of over 7 is over 0.7 is considered really, really strong. Getting into the 0.8, 9, or 1.0 and above is moving more into even a clinical realm. So these are very strong Cohen's D's. And in addition, we're literally looking at this for a whole host of different outcomes, which we won't get time to talk about. We want more of a discussion, but did want to show you that we really are finding very, very strong outcomes as a result of this purposeful application. With respect to Resourceful, we're already getting really interesting feedback from people and quite alarming stats. Kate, did you want to talk just a little bit about that?
Yeah, so for the Resourceful, we piloted about 2,500 employees. And so we've rolled out asking questions. Are you struggling with food? Are you struggling with housing? We see top domains, at least in the initial pilot, around stress, around financial strain, around food. And, one of the things that that may resonate, we, as I mentioned, have a number of folks over time that we end up hearing about an employee that may be struggling. Just this past week, I got a phone call from our frontline HR manager down in the Columbus market and said, hey, I have an employee who was in a domestic violence situation, has a 13-year-old son, and is currently living in her car, right? We activate and we help get her connected to the right services and supports. Unfortunately, today, we're only hearing these on one-off situations. And so one of the things we're really excited about Resourceful is to have a comprehensive really full and total picture of what the needs of our workforce is. So that isn't just the one individual that we happen to hear who connects with the right HR manager, but it's really this universal understanding and helps as an employer start to develop resources and programs to connect. So if we're seeing trends around stress or seeing trends around food insecurity, we can then really activate the right responses. And so for us, it's something we're really excited about deploying and really understanding those needs and starting to shift from our traditional wellness. I think, Vic, you say the broccoli and treadmills, to thinking more about some of the basic needs like food and transportation support. So it's
And
been a long journey.
I think at ProMedica, there was some data now showing that 30% of employees were having food insecurity problems, that over 50% had financial insecurities. This is really big, less so in housing, not as many housing insecurities, but that may be because of the Toledo area where ProMedica is headquartered may have more available housing. But certainly in terms of finance and food insecurity and some of these others, they were mapping even higher than the general population of full-time employees in the country.
Yeah, and Vic, it's the first time that we've seen data, and while it is a little bit painful to start to see that, that data allows us to take action, right? And so it's the first step in this journey to think about how we shift our traditional wellness programs to really meet more of the basic essential needs.
Can you unpack that just a little bit? I'm really interested if we go into an employer and say, we would love to learn more about the social determinants of health. An initial response from a CEO might be, we pay people well enough. Nobody has these kinds of insecurities. Is that the sort of thing? That's why this assessment might be important to basically show people. But do you think, we could run into resistance as we try to pitch this to the C-suite, so to speak?
Yeah, I think the first barrier is even some of our language, right? Folks, social determinants is kind of this wonky term that doesn't really resonate. And so really thinking about—
It's so public healthy.
Very public health, right? And so how do we talk about these basic needs or essential needs in a way that resonates? And it's been interesting as we've had a lot of dialogue with some of our C-suite. Some of them right away, where they have a strong organization mission or they're focused in really helping people or in the service business, it starts to connect. What's been so interesting as we move down and even starting to talk about with our frontline managers and managers in other corporations, they instantly say, oh my gosh, yes, we do have this challenge and I don't know what to do about it. I'm getting employees that are coming that are struggling. And one, either I don't know what to do, I don't know how to help them, or two, there's not enough resources. And so it's been a really interesting dialogue, again, with both the C-suite, but even as you move in and start to have dialogue with the frontline employees as well and managers.
So just like in smoking, you don't want to tell a person how bad smoking is for, all the time if you don't have a way to help them quit. I mean, it's essential to give what's called response efficacy. And that's what we're doing with Resourceful. We're saying, okay, here is the problem that you have, but here is the solution.
Yeah, that's right. And we have two really great questions. One, how do we help the wellness industry shift its focus from being focused on how to really starting to understand the underlying philosophies of the why on purpose?
William McPeck, you are after my own heart. I'll tell you, we just do not talk about the why of change enough. Really great health coaches do. And life coaches do. They start off with your purpose, your why, what we call often your B goals. I'm here to be this. I'm here to be a family man. I'm here to be a good teacher. I'm here to be a global citizen. I'm here to be a supporter of the arts, whatever. And then you start saying, okay, how are you going to do those things? In order to be a good family man, I need to do certain things like be calm. Okay, well, that's fine. But how about some really crispy action goals? Some of you are familiar with BJ Fogg, talks about crispy behaviors. How do you provide those? That's what we do. That's exactly what we do. But we start with the why. And that is what's so important. Beginning with the why, I can handle, as Friedrich Nietzsche said over 100 years ago, I can handle almost any how. So it's really important. And thank you for bringing that up. I think increasingly our field is understanding that the why is the first step before the how. We know a lot of how-tos, as William McPeck says. Dina Morgan, yeah. Have you noticed any difference between male adapters, yeah, to apps? We actually, in traditional wellness programs and well-being programs, women are more likely to enroll. With respect to our app, we're often finding men are more likely. In many of our situations, we're actually finding more men than women, but we find more of an equal balance of men and women using our programs. Yeah. So, Kate, any little cases or pieces of wisdom in this?
Yeah, no, I mean, I think it was a great discussion. This is certainly a
Yeah.
big shift. And so, the traditional wellness, even from an employer perspective, we've got to think differently. We have to start to think more creatively, but also get to those root causes. And so let's not just treat the symptom, but let's really get to the why and let's get to those core issues. And this is not something that's going to happen overnight. But it really is the right focus, and long term, we really believe it's the right direction of both the industry and the right direction that employers take as well.
We have a picture of a person down here. Do you want to describe who that is and what's going on with her?
Yeah, so LaShonda was actually, I was the individual, the mom that I described that was in a domestic violence. I will say that this is a stock photo. So obviously we protect the identity of all of our employees and patients that we serve. But this is just one example. Again, we hear this anecdotally, one off. We get the one-time example of an employee that's struggling, but it's really how do we as an employer understand universally where the needs are and start to direct resources across the board. So I think again, it's a big ship. We've got to really change the industry and think of differently, but it's certainly the right step, the right direction.
So I think what we've been trying to do in this webinar, Kate, is first of all, identify the problem. And I hope we've identified the problem to people's satisfaction, and that problem might be broken into and summarized by saying, people are hurting right now. They are having a hard time. The pandemic and other social issues, as Paul Terry had mentioned, are exacerbating that. And those things aren't going away. It's not suddenly, we're going to have people immunized, we'll have herd immunity. Oh, good, poof, this goes away. This is not going to go away. This is a new way of working, a new way of thinking about supporting our employees. And the large majority of employers are saying that the current kinds of programs are not working for them. Going back to root causes, thinking about these personal determinants of health in a deeper, more core way, asking about the why, as William McPeck said, and also in these structural factors, trying to deal with those structural factors more effectively, very important. We have built a model that tries to look at that. And it's, really centered around resilience. It's centered around purpose, emotional self-regulation. It's centered around SDOH and dealing with those things. And so that's why we're talking about these new interventions. I'm sure we'll see other interventions out there, and I welcome them. I think that we should be raising the bar and trying to get our field to start thinking about these issues in a little deeper way than we have. I think we've been dealing a little bit too much in the surface level. As you had mentioned, broccoli and treadmills, which is still important. I still eat broccoli and I still work out. It's still really, really important. But why do we do those things? Getting to the why is important, and allowing people the space structurally to be able to do those are really important. So we have a couple of other questions here. Kate, do you have them?
Yeah, the first one, so Vic, this one's for you. Does Kamanu collaborate with clients on rollout, training, and communications, starting with
yes, absolutely. We have leadership training in Purpose. We have really spent a lot of time developing and perfecting a very, very strong, powerful communication strategy, a rollout strategy with multiple channels. And that's one thing we know in our field over 30, 40 years of research that works. We know that multiple channels work better than just, oh, I have an app, or I just have this coach, or I have this, presentation. It takes multiple channels. It takes workshops. It takes regular email communication. It takes polling and understanding. It takes webcasts like this. It takes an app. It takes surveys. And those are all the things that we're doing. So it's really important. Carrie Evers. Hi, Carrie. How are you? Go ahead, Kate.
Just curious, Vic, from obviously it's been a really interesting last year. Are you seeing with the a lot of folks working from home, how are you seeing kind of new communication styles impacting employees and any shifts that you're seeing just in a COVID environment?
Yeah, Amy Wisniewski is a professor at the Yale School of Management, the business school there. And she says, now that we are left at home, we're only left with the work now. And we have to start asking ourselves, does my work matter? And then, do I matter? And so there are bigger existential questions people are asking. And so it's important, typically, if you're all with a group, a team, you feel it even, you're together physically and you're feeling that purpose and direction. You feel the energy. We need digital tools to help us do this now. And we need them more than ever, actually, that can reach out. And I know some groups are getting together again and working. I know you are, Kate. But I know our team at Kumanu has been working remotely for well over a year now, and we'll continue until we feel it's okay to move back. So we have had to learn new ways of communicating, and that's where these digital tools might be able to help a lot. Yeah. Carrie, you had a question here. Curious if in your poll you're looking at small, even micro employers and large employers. Yes, we do. And yes, we do. So we do see differences. And Kate, tell me your opinion about if you're working with a smaller employer versus a larger employer. Are there any differences in how they perceive this kind of issue?
Yeah,
social determinants.
it's a great question. So a lot of the employers that we're in dialogue that are smaller employers, and I'm going to say, those that are less than 100, let me just kind of categorize it a little bit. There is a tighter sense of relationship. And so we are seeing employers both knowing what the needs are for the employee. A lot of times when you're in a smaller environment or a smaller company, the employer, the managers have a better line of sight on what their employees are personally going through. So we do see some differences there. Obviously, though, we also see, sometimes less resources in smaller companies. So while there might be greater line of sight, sometimes there's smaller resources. In the larger employers, there are some employers who have compassion funds or have some resources for those kind of one-time crises, but it's obviously more difficult to have a deeper understanding. We have about 60,000 employees spread across 30 states. And so it is really difficult. It's hard to know in a very large company where there are needs. And while you might be able to help one employee at a time, we really haven't had that universal overall understanding. Where is the need for those 60,000? And are those differences by geographic area? Are there differences by domain? Someone had asked a question before, are you seeing an employer willing to support something like food versus transportation? So this is really the first time that we're able to say across the board, here's where the needs are for our entire workforce, and then be able to tackle them.
Wow. Yeah, absolutely. And if you are spread out all over the country, making sure that the resources, if I have food insecurities, making sure you understand the local food banks and local assistance that can be provided is a challenge. That's something we've built into Resourceful, though, because we know that if wherever you are in this country, you should, we should be able to identify locally what's going on to help you. Is that?
That's right. And Sarah Johnson actually has a specific question. So hi, Vic, can you say more about the resources linked to
Hi, Sarah.
Or leveraging 211 or findhelp.com?
Yeah. Kate, would you mind unpacking that just a little bit? How are we identifying local resources?
Yeah, so a couple of things. One of the things that we do as we start to work with an employer is to really understand what are the existing programs and services. Many of the companies have an existing EAP or existing supports. So really just starting to benchmark what currently exists around those employee offerings, and then starting to connect to the local resources as well. And so we are in the process of building out those local resources and understanding, obviously, each community is a little bit different. And so how do we make sure, one, we understand what the resources are, and two, we're able to connect to those different supports. So in a lot of discussions on the product build right now about making sure that we have that connection across the country.
Thank you, Kate. Paul, we have 6 more minutes. So how do you want to handle those 6 minutes? Do you have any questions?
Well, this has been so robust, and I'm so grateful that you two are such a team as it relates to their seamless ability to go back and forth between science and practice, between concepts and telling stories, really effective.
Thank you.
Yeah, let me actually launch one poll that is intended to kind of get you to talk a little bit about measurement. You've come back to this quite often, Vic, that, you know, this is pretty basic, this question of purpose. How do we
Yeah.
figure out people's purpose? And there are standard tools. So let's use a question that comes from one standard tool. Some people wander aimlessly through life, but I am not one of them. It's a bit of a double negative in there. So I added a little twist by saying, I strongly agree I'm not aimless, all the way down to strongly disagree, my life is aimless. Cheers to serendipity. You brought up Nietzsche, and he's in one of my poll questions as well a little later on, Vic. But as we're waiting for results here, are there standard public domain tools that our U.S. Preventive Services Task Force like in their acceptance in the community, and any that you particularly favor that we know about or access?
Access to measure things like purpose in life.
Exactly.
Yeah, well, this one item comes from Carol Riff's purpose in life questionnaire, and it has 6 items, and this is one of the items, and I love this item. I have, some people wander aimlessly. I'm not one of them. In other words, do you have a direction? Patrick Hill has 4 items that he asks about, and the way I view purpose is that it's a goal or set of goals around the things that matter most in your life. So you want to find out whether you have things that are important in your life. And as some philosophers have said, we need to care about what we care about more. So first, find out what you care about. Second, care about it more. In other words, set goals around the people and things that you care about, the causes you care about. And maybe you don't have people in your life, then maybe you have a cat. So care about your cat more. But set goals around that. We know that setting goals works better than saying, I'm going to do my best. So those are the kind of best metrics. Patrick Hill has a great metric of 4 items. Carol Riff has 6. I think overall, I like both of them. We tend to use Patrick Hill's more. In fact, we work closely with Patrick Hill, one of the world's experts on purpose, and we use his scale in our Harris poll. So yeah, I think that's strong.
As you saw, most people agree they have a purpose in life, although some are not so sure. Here's another question. I have a sense of direction and purpose in my life. When you think about how powerful the U.S. Preventive Services Task Force guidelines were to our field in terms of asking questions that are risk adjusted or gender specific, or at what intervals to ask, is there any parallel going on in the purpose research field, Vic, in terms of how often we should assess? The question earlier about gender differences, age differences, risk differences. What's your take on?
There are now, this year, we have exceeded 1,000 research studies that cite purpose in life. So we are learning more, and it's going up literally exponentially. So we're seeing a huge number this last year, 2020, related to purpose in life, and we're seeing better metrics around it. We're looking at better studies. We're trying to dissect what is it about purpose that helps people live longer, change their behaviors more, develop greater emotional self-regulation. We're doing a lot of neuroscience studies of this. And so with all of that, we are uncovering what's going on. Why does having a direction in your life, a purpose, a set of goals around what matters most, lead people to make significant quantum changes in their lives? It turns out to be really important. But again, I want to emphasize that going the other direction, that other side, are these structural issues. And those structural issues can reduce your purpose, they can reduce resilience. Dealing with both of them is really a yin-yang, as far as I can tell in this. So super excited about the future in this area.
All right, so there's one more poll question that's so important, Vic. You alluded to 6th Street, which is like the Bourbon Avenue of Austin, Texas.
It's
People
the best.
jump into the chat function right now. I want to see who knows in this audience getting ready for Austin, Texas, in October 11th, week of October 11th. Who knows who is the rock and roll icon? Any bar you go to, they better be playing this performer. And here, I'll give you a clue. Go ahead and jump in the chat and tell me when you know the answer to this question.
I know it already, Paul. Do you want me to give it to you? I want to see everyone dance now, okay? Can we have everyone dancing?
All right, who knows the answer, Vic?
Stevie Ray Vaughan.
Excellent. If you go down on Lady Bird Street and walk
Come on.
the path, it's such a fitness-oriented town, you'll see a beautiful statue of Stevie Ray Vaughan. So Kate Sommerfeld, Vic Strecher, you guys are just awesome. Thank you so much for your work today. And with that, we're adjourned. Thanks a bunch, you guys.
Thanks so much, everyone. Look forward to talking with you. If you have any questions, let us know.
Thanks. Have a great day.